Hi guys, it's Dr. Michael Unife here from Breast and Body Clinic. Today I wanted to discuss treatment options available for gynaecomastia. Very simply put, this will depend on the causes in the first place. One of the first things that we'll do when you come to see me is we'll run a full panel of tests to make sure that we've excluded all the serious things. Commonly, things that cause gynaecomastia, of course, include weight gain, like steroids, particularly for guys young age who are trying to get buff. Of course, it could be also physiological and what have you. So the options available essentially threefold. In some cases, weight loss will be a good option, and we'll encourage that in a lot of our patients that fit in that category. The other alternative is to do what's called watchful waiting, is to see how things progress, particularly when this is a physiological cause and occurs naturally in some of the periods of a men's lifespan. And then we come back to really two main options, which include medical or surgical. Medical options include using drugs like tamoxifen and raloxifene, which have been studied a little bit in this field and only recently really have been tested to try and see whether they can be of benefit, and maybe 50 to 60% of cases there's been some success, but the evidence is pretty slim. Only a few small studies have been done to look at this in this particular setting. I have to say that a lot of the men who have who've done steroids in the past have often used tamoxifen as part of the regimen to avoid getting gynecomastia, and a lot of them get it anyway. So they have often self-selected before they come to see me, having already tried this particular approach. So if we discount that, then we can look at the surgical options, and these of course include things like mastectomy plus liposuction or liposuction alone, or mastectomy alone. And the combination of these factors will be involved depending on what type of gynecomastia or lipomastia, another option, is actually occurring in this particular setting. Hopefully this gives you a little bit of a rundown, and depending on where you are in this particular set of circumstances, we'll be able to discuss your own goals and your own options more clearly. If you have, as usual, any questions, feel free to ask me. Have a nice day.